Hello, Assalamu alaikum. In this video, we will learn about the Kawasaki disease. It is the medium vessel vasculitis. Remember, this Kawasaki disease occur in the children. So, what is the Kawasaki disease? Blood vessel to become inflamed due to the bacterial infection or other causes, but the causes is unknown. Coronary blood vessel inflamed and common in UK, 2 to 3% fatal cases. Around 8 in every 1 lakh children developed Kawasaki disease, 1.5 times common in boys than girls. So this is the coronary artery disease, basically occur due to the inflammation of the artery. The inflammation will lead to constriction or aneurysm, etc. The uncommon disease, the affect medium size vasculitis. The medium size vasculitis, the medium size of the blood vessel will be inflamed. Inflammation of blood vessels and childhood acquired disease. This is the childhood acquired disease, for short the CAD. The coronary aneurysm is the occur and the exact cause is unknown, remember. But in this video we will understand about the pathophysiological aspects, how it can develop. This is the person, child, uh, which that contain a coronary artery, and this is the coronary artery, the bigger picture, which that's contain tunica externa, and this tunica externa contain dendritic cell, and in this way that a smooth muscle cell layer are present is known as the tunica media. These separate via a external and internal elastic layer. Inside is the endothelial cell, and this inside is the lumen contain WBC and RBC. This WBC is the white blood cell, which that the antigen presenting cell we represent, like staphylococcus and streptococcus is the theoretical explanation, but it can be occur, but the complication, the infection is unknown. In this way, the antigen presenting cell will activate when go into the lymph node, the CD4 activation and CD8 through CD4. And in this way, the B lymphocyte activate to produce IgA antibodies. This IgA antibody mimic the molecule of the endothelial cell. It means it is the auto antibodies. And monocyte also and neutrophil infiltration will lead to inflammation of the smooth muscle layer. This inflammation, which that will lead to endothelial dysfunction and cytolysis due to the antibodies attack on the surface of the endothelium, will lead to recruit the macrophage, but infiltration of the neutrophil into the smooth muscle layer of the cell, and aneurysm will occur due to the inflammation, and the endothelial growth factor also involved for the again regeneration of the endothelium, fibrin, collagen, and cell debris deposition in the smooth muscle layer. The clinical feature is the more than 5-year-old and high-grade fever for more than 5 days. For short, we can clinical feature covered by the cream. This is the CREAM. Cream means the C for conjunctivitis, the bilateral non-papulent, and the rashes, the polymorphous maculopapular, and the erythema and or edema of hands or feet, adenopathy and lymphadenopathy, and the mucous membrane changes. Bilateral non-purulent is the conjunctivitis, and rash is the polymorphous maculopapular, and adenopathy, arrhythmia, and edema, hands or feet, and adenopathy and lymphadenopathy, mucous membrane changes, and or red tongue, eyes, and dry crackle lips, and slow but swollen tongue. Investigation is the full blood count test and EUC test and LET test and CRP, urine analysis. On the other hand, the echocardiogram and check for myocardial inflammation, coronary artery, and aneurysm. If the aneurysm will occur, we can identify through echocardiogram, or the biopsy can be diagnosed. Anyhow, let's understand about the different diagnoses. So how we can diagnose? One by one we will understand first of all the measles, exudative conjunctivitis on the eyes also occur as well as measles, while on the other hand the rashes on head to trunk. Number 2 is the drug reaction, generalized rashes in body and cause itchy, maculopapular rashes and urticaria. This drug reaction will lead to also cause the Kawasaki disease progression. On the other hand, the streptococcus infection is the but unknown, but we can say that because sometimes streptococcus and pharyngitis can occur, and scarlet fever, rheumatic fever, and staphylococcus infection if possible. So the staphylococcus scarlet skin syndrome occur, and the red blistering skin occur. Toxic shock syndrome will be progressed due to the Kawasaki disease. And this is the diagnosis because it is correlation with the Kawasaki disease. And on the other hand, the Steven Johnson syndrome also relate and viral rashes occur. In this way, we can say that it can be a possible the viral infection. Kawasaki disease treatment with the immunoglobulin intravenously. Immunoglobulin intravenously provide and will lead to cure the Kawasaki disease, and aspirin. Aspirin is the anticoagulant because the coagulation will occur due to the thrombosis formation as well as the coagulatory process. Anyhow, the myocardial infarction, stroke, attack, and headaches, and rashes, and allergy. So this is the medium vessel vasculitis. If you want to complete watch the medium vessel vasculitis video, you can watch that in my pathophysiological playlist, and you can search that. Thanks for watching. If you like my video, please make sure to subscribe, like, and share. See you in the next video. For this time, bye. Basically, we have covered the second video of the medium vessel vasculitis, the medium vessel vasculitis. So this is the second video. This is the part of the first video. Please make sure to subscribe. See you in the next video. Bye.